Good afternoon, and thanks for joining us for today's Healthline 3. I'm Courtney Butts, and today in Healthline we are talking about robot-assisted general surgery, and specifically with a focus on hernia repairs. And joining us to talk about this is Dr. Kamel Brakta with Willis-Knighton General Surgery. Thanks for joining us.
Thank you for having me, Courtney.
Absolutely. So tell us first a little bit about what you do at Willis-Knighton as a general surgeon.
So as a general surgeon, my job is basically to help patients who need general surgery, and which is a variety of different type of procedures that we do. And within that realm, the robot is another tool that helps us get the job done and offer patients minimally invasive surgery when it's applicable.
Yeah, and we were kind of talking off air about those common procedures that you do, and gallbladder is one of them, hernia is kind of the most common.
Right, absolutely. There's a variety of different types of procedures that we do. These are all intra-abdominal procedures where the robot really offers us a lot of benefits to the patients. And among some of those procedures are gallbladder procedure, which is removal of the gallbladder, which is one of the most common procedures that we do. We also do a variety of hernia repairs robotically, and those hernias can be groin hernias, which are the inguinal hernias, or any hernia on the abdominal wall. Umbilical hernias are also another type of hernia. We also do hiatal hernias, which are hernias that involve the stomach, when the stomach slips into the chest.
Right, okay. Yeah, and so with the robotic assisted surgery that you do perform, how do you feel like that has advanced just the surgery that you're able to do on patients?
So robotic surgery has really taken off in the last probably decade or so. Traditionally, minimally invasive surgery was done laparoscopically, which is really similar to robotics, but the robotic technology has really become way more advanced in the last several years, which made the operations a lot more minimally invasive and certainly offer more benefits to the patients in the way of faster recovery, smaller incisions, less trauma or tissue trauma during surgery, and of course, most importantly, patients tend to go home same day or the next day and return back to work faster than usual.
That's awesome. And so how does it, I mean, obviously those are some of the benefits of robotic surgery. So the traditional methods, what did that previously look like? So,
traditionally or throughout, the last probably 3 to 4 decades, before that, most of these operations were done open. Where patients have big incision, they're usually in the hospital for several days, even several weeks. Nowadays, we've come so far to where the vast majority of these intra-abdominal procedures, especially on the elective basis, are done either laparoscopically or robotically, which of course is very beneficial for the patients and, shortening that length of stay in the hospital and helping patients get up, move early on, and get back to their lives fairly sooner than otherwise.
Absolutely, yeah. And so for hernias, are they all, you mentioned several of them earlier, are they all suitable for robotic surgery?
Yes, the vast majority of hernias, on the elective basis, meaning when patients show up electively, are done or can be done robotically nowadays under a controlled setting where patients obviously benefit from that technology and from all the benefits that the robot offers from any of those variety of procedures.
Yeah, and so when you're talking about using a robot, tell me, when you're in the surgery room, where is the robot and where are you?
Right. So the robot, it's essentially a tool. I know sometimes I do get patients that ask me whether I'm doing the procedure or the robot is doing the procedure. And the robot is just a tool, and we control everything. The surgeon controls everything. In other words, the robot doesn't do anything that I don't make it do or control it to do. So it's basically a tool that has several arms that sort of are put on the patient. And then the console, which has the hand controllers, is usually in the same room, just a few feet away from the from the patient bed, and the surgeon sits at the console, and through the facial visual piece along with the hand controllers, you're basically controlling the entire robot, and you're seeing everything in a three-dimensional image through the console.
Yeah.
It also enables us to magnify the surgical field up to 8-fold magnification, so which really helps give you a very high resolution of what you're looking at, and the tissues and the work that you're doing.
And it probably makes you more accurate, as a surgeon as well.
Absolutely. One of its benefits is really increases the accuracy. It helps us be more precise and very deliberate in what tissues we're operating around, and it also helps us minimize that trauma that we create in order to do surgery to the tissues. So.
Yeah. Okay. And so let's talk for a second about a hernia. Because for someone that may have a hernia, what are those symptoms that present, and then when should they come and see someone like you?
So usually most hernias that involve the abdominal wall are a result of some sort of a defect within the tissues that cover the abdominal or the abdominal cavity, so to speak. And usually patients will start having either pain or may notice a bulge anywhere in the abdominal wall, around the groin region, around the umbilicus, around a site of surgery that from previous operation. So usually those are the symptoms that patients will notice early on, is discomfort, a bulge, and obviously these hernias are progressive. They may start smaller, and then usually over time they can grow and get larger, and that's when they really interfere with quality of life and daily routine. So.
And what you're doing in the surgery is removing the hernia, right?
Correct. What we're doing is essentially dissecting or working around that defect, identifying the defect, and then closing the defect, and usually reinforcing it with mesh if need be. And mesh is basically, synthetic, can be either synthetic or biological, to help strengthen that repair that we do. And
what happens if you don't fix the hernia?
So usually the hernia, the natural sort of progression of that hernia is it gets larger, it can get more painful. There's also the risk of the bowel or contents from the belly or the abdomen protruding through that hernia, and there's always the risk that those contents can be squeezed by that defect and can compromise blood flow to the intestines, for example, to where it becomes an emergency.
Yeah. Okay. So definitely want to get that checked out for sure. Well, if you're just joining us, we are talking with Dr. Kamel Brakta, talking about robotic assisted general surgery, and specifically talking about hernia repair. And if you are just joining us, Healthline 3 is where we like to focus on ways to live a healthier, happier, and pain-free life. And we are now opening our phone line. So if you have a question for Dr. Brakta, that number is 318-219-4569 right there on your screen. So give us a call. We'd love to hear your questions. And I'm going to continue with my questions. And so talking about, just the extensive history of just robotic surgery, and you said in the last decade you've seen a lot of the advancements in the surgery. So how long have you personally been using the robotic surgery? So
in my practice, we've been using the robot now for 10 years, or approximately 10 years. Which is really how long I've been here in Shreveport, a little over 10 years now. So. Cool.
And what is the robot, what kind of robot is it? I think.
So the one that we use is called the Intuitive. Devancy robot.
Yeah.
So, which is really the only, one of the only robots now that's widely used throughout the U.S. and even throughout the world.
Okay. Very interesting. And so of course, anytime you go under the knife, there's always going to be some kind of risk. But can you talk through some of those risk factors, and maybe for a patient who's wondering if they're eligible or a candidate?
So of course, as you mentioned, every surgery comes with risks. There is no such thing as zero risk when you're undergoing an operation. But nowadays, again, because of the advancements in minimally invasive surgery and how we do these procedures nowadays, it's a lot, the risks are a lot less than they used to be. Especially if patients don't have extensive health issues or heart issues or lung issues, then usually the risk is very minimal.
Okay, well that's good to know. And so when you're talking about minimally invasive, you mentioned, versus traditional methods where you might have like this huge incision and it takes forever to recover. Talk about that incision. How big is it, and how many do you usually make?
So depending on what we're doing, the incisions are usually about 1 centimeter, which is about ½ inch, or even slightly less than that. And they can be anywhere from 3 to 4 up to 6 small little incisions, depending on what we're doing, depending whether we're doing hernia repairs or if we're operating on the intestines, etc. But essentially, that's the extent of the incisions.
Nice. Yeah, a lot better and easier on the recovery. So let's say someone has a hernia and they know they have it. Do they need to be referred to you by their primary care physician, or how does that process work?
They don't necessarily have to be referred, depending on what type of insurance they have, but the vast majority of patients can just refer themselves and can contact our office directly and make an appointment if they so choose to.
Yeah, and is this typically an elective surgery?
Right. Most of these hernias, like I said, as long as they're not, if you don't have any, severe pain or bowel that's stuck in the hernia, those are usually emergencies, and most of those patients are in a lot of pain to where they do end up in the emergency room.
Yeah.
Otherwise, if the hernia is not causing a lot of pain and it's been there for a long time, and usually you've noticed that it kind of goes in and out, then most of those patients can come on as an outpatient on an elective basis.
Okay, outpatient. So how long from start to finish? I'm sure it depends on the hernia and where it's at. How long does it typically take you?
Right. On average, depending on, again, the hernia type, anywhere from 30 minutes to an hour and a half.
Nice.
Usually, in general. Those are the vast majority of hernias.
And it's an outpatient procedure, right?
Correct. The vast majority of them, about 90% of them, are outpatient, meaning have the surgery done, then recover, then go home the same day. And usually patients are up and about that same day once the anesthesia wears off. And most patients are back to their regular routine within a few days, anywhere from 3 to 5 days.
Okay, so kind of full recovery takes maybe anywhere from 3 to 5.
Correct.
Okay, maybe sometimes longer depending on how extensive.
Depending on how extensive the surgery, depending on the hernia type, maybe either less or more. Correct.
Okay, well that's pretty good news for someone wanting to kind of get back into it, and definitely better than traditional methods with the robot and all that. So so what about afterward? So like before and after with your patient experience, do patients ever report to like feeling better, maybe having relief from getting that hernia out, or
absolutely.
fixing it?
So these hernias, as they get larger, they become more cumbersome, especially in patients who are healthy, active, who want to remain active, who want to do more. These hernias can really get in the way. And once you fix a hernia, patients usually tend to, get back to their daily routine, or are able to do more things than they would otherwise be able to do, because the hernias can really limit your ability and how much you can do when it comes to lifting. Because the more you lift, if you have a hernia, the more you lift or the heavier you lift, the worse that hernia tends to get, because of the rise of the intra-abdominal pressure. Because every time we lift something or we strain, you're increasing the pressure, which is directly applied to that hernia.
Go ahead.
So it's in terms of quality of life, it's a huge difference for patients who are active and want to get back to their routine and want to get back to especially if their work is physically demanding.
Yeah, and so how would you suggest someone maybe go back to the gym or go back to their heavy lifting job? How long should they wait?
Usually we recommend no heavy lifting or going back to extraneous exercise anywhere from a month to 6 weeks.
Okay,
on average.
Okay, yeah, good to know. And so are there any specific patient characteristics or medical conditions that may affect the suitability of using the robot?
So, as we spoke earlier, emergencies usually preclude the use of the robot, because if you have a patient that has an emergency or an emergent surgical condition, usually those patients are rushed to the OR emergently, and those procedures are usually done open. So that's one of the exceptions. The other, if a patient can't tolerate being put to sleep or being under general anesthesia, then usually that can limit the use of the robot if they're not candidates for or can't tolerate general anesthesia. And usually these are patients who really have severe heart issues or heart disease, severe lung disease. Those are usually the patients that may not tolerate general anesthesia, which also means they may not tolerate robotic surgery.
So they would be a better candidate for open at that point, or what?
No, even for open, they may be high risk.
Okay.
Again, because they can't tolerate anesthesia. But usually, if you're a candidate for open surgery and it's an elective surgery, if it can be done robotically, then you're also a candidate for robotic surgery.
And I think you bring up a good point. When it's emergent, you are rushed to the ER and you are then going under that open procedure, and it's like, might as well go ahead and elect to do the minimally invasive robot surgery so you don't have to get to that point.
Exactly.
Yeah. I think we have a caller on the line. The name Joe, was it Joe? Oh, Dalton, sorry. Dalton, thanks for joining us, and what's your question?
Yes, I've got a hernia on my abdomen. It's on my belly button, and I'm wondering if this surgery can help me.
Yes, certainly. Dalton, right?
Yes.
Thank you for calling in, Dalton. Absolutely. If you have a hernia around your umbilicus, you may have had it for a while, and you may have noticed a bulge there with some discomfort, especially if you're physically active and you're lifting things and you're, depending on what you do from day to day. But yeah, we can certainly help you. You're certainly a candidate for robotic repair of that hernia.
Yes, my age is 76. I'm one up in age, and a lot of doctors won't look at me as far as doing the surgery.
As long as you're active
surgery
and
will help.
yeah. Go ahead. I'm sorry, didn't mean to cut you off.
Oh, that's okay. Go ahead.
I said as long as you're active and you're able to move around and walk and do the things that you like to do on your daily life, then you can certainly be a candidate for repair. We operate on patients a lot older than you who are of course healthy and active.
No, I do have cirrhosis of the liver, and my abdomen, I have to get it drained every week. Does that matter?
I'll be happy to discuss that with you if you'd like to come to the office, and we'll go over all your options and discuss what's feasible and what's not.
Yes. How do I get an appointment?
You can just call our office, which is 318-212-6270, and we'll be happy to see you and work with you.
Can you give me that number one more time?
Sure. It's 318-212-6270.
And which
6270.
and
Correct,
which
yes, sir.
location are you at?
And we're at WK North on Greenwood Road.
Great. That's the closest one to me, so that's good.
Perfect.
Great.
Well, Dalton, thanks for giving us a call, and hopefully you'll get everything worked out. And if you're just joining us and you had a question for our doctor, give us a call at 318-219-4569. Okay, so hernias, we talked about belly button hernia. So which ones are all hernias okay for the robotic surgery?
The vast majority. Now,
Okay.
we may have, sometimes we run into hernias that are, massive or very, very large, and sometimes those may not be candidates or may not be feasible to do robotically. because of the size of the hernia and how much and all that's involved in order to mobilize tissues and things like that, to where the robot may not be as effective.
So kind of piggybacking off of Dalton, let's say, he goes to your office and y'all set up an appointment. What can someone like Dalton expect in that first appointment? What are those tests that are going to be run and that kind of thing?
So we usually look at look at his symptoms, look at the hernia, look at the size of the hernia, and then of course we also ascertain, if he has any other health issues, or especially involving the heart, the lungs, and then we typically do a scan. If need be, depending on the hernia size, we may do a scan, a CT scan, to take a look at the hernia, give us more information about what the hernia looks like, the size of it, what's in it, etc. And then we proceed with, if the patient is a candidate, is a reasonable candidate for surgery with minimal risks, then we'll proceed and offer them surgery.
Okay, nice. Yeah, and it's very, I'm sure, individualized. Each case is looked at in a very individualized basis, and based on where it's at, and
Yep, absolutely. Each patient is different, and each hernia is different, and you're right.
So if someone has a hernia, the presence of a hernia wherever, are you more likely to have another one in another location, or not really?
Not necessarily. These inguinal hernias are usually more common in males than female. Patients may also have hernias from previous operations. We also see a lot of those hernias where patients have had surgery in the past, and because of that weakness that's caused by surgery, usually these are open procedures with large incisions. So then if the tissues at that incision are now weaker than what they used to be, so then some patients will have hernias through that previous site of surgery. So that's another common type of hernia that we see.
Makes sense, yeah. And so for someone that maybe doesn't have the presence of hernias at all, is there any preventative tactics? You keep saying active individual. Is that something that someone should, pursue, an active lifestyle?
Oh, absolutely. I mean, I think, it's really important that patients in general, all of us really, stay active and try to, incorporate some sort of activity, exercise in our daily lives. It's good for all of us.
Yes, good tips. And are there any, long-term outcomes or even studies of the effectiveness of robotic surgery versus traditional?
Yes, there are certainly studies in the last several years, and there continue to be more research in this arena in terms of the benefits of robotic surgery. And of course, they are comparable to laparoscopy, because laparoscopy has been around a little bit longer than robot for the last probably 3 to 4 decades. But absolutely, all the benefits that we've talked about, we discussed earlier, have been proven by reviewing data and looking at research.
Yeah, okay. And so if someone is interested in setting up or, an appointment with you, and then let's say they do go forward with surgery, what is typically covered by insurance?
Most of these procedures are covered by insurance.
Okay. Even if it's like elective or? Yeah,
elective,
nice.
Or hopefully on an elective basis. Obviously, if you have a hernia and it's causing problems and it's interfering with your quality of life, it's better to get it repaired on an elective basis before it becomes either larger or cause problems down the road.
Good, yeah. And like we said earlier, we don't want to end up in the emergency room with that open procedure where you have the much longer recovery. So yeah, what is the recovery difference between like an open procedure for your hernia versus the 3 to 5 days?
Right. So usually if you do the procedure robotically, again, most patients go home within 1 or 2 days and are usually up and about within, like I said, 3 to 4 days. But if these procedures end up done open, then patients tend to have a slower recovery. They may be in the hospital an extra day or so, and when they go home, they're still down for several more days than otherwise because of that pain. Because the open procedures tend to be more painful than the laparoscopic or robotic procedures.
Absolutely. Well, we have another caller, Fitzgerald. Sure. Thanks for joining us. And what is your question?
I'm Fitzgerald Hanover.
Hi there.
I would like to know. Same here. I'd like to know, how does Shreveport compare with the rest of the United States? Do we have more hernias than any other place in the United States?
Not necessarily. I think we're just as comparable to the rest of the United States as any other place. So we don't necessarily have more hernias or less hernias than the rest of the country.
So we are very active people here in Shreveport. I'm from Florida. I'm from Fort Lauderdale. But I wanted to know what the people are like here in Shreveport.
I think it's the same as most of the country. I think you have a spectrum of people that like to be active, people that don't like to be active. I think it's a mix of all those groups of people.
My last question is, I watch wrestling all the time, and these people seem to be able to pick other opponents up. Do these wrestlers get hernias?
They certainly are at risk, just like anybody else. I think what may distinguish them from the rest of us is that they tend to work out a lot and be a lot more fit, and certainly they have a lot more strength than perhaps myself or any person that's not in the business of wrestling. But yeah, they still have a risk of hernias, especially certain types of hernias. Yes.
All right, thanks Fitzgerald for these questions. And yeah, I mean, I'm sure coming from Fort Lauderdale, Florida, there's many other things that you can do outside, versus our weather that we have in Louisiana. It's kind of a roller coaster sometimes, so that probably impacts our activity as well.
Absolutely.
But thanks for your question. Those are pretty fun questions. Wrestling, I'm sure that there have been our fair share of wrestlers. We should just, call up one of them right now and see. I'm sure that they have many. I mean, even like spinal procedures and stuff like that. So they do a lot of damage to their body for sure. So yeah, so we've talked a lot about, the traditional methods versus the robotic methods. And this is kind of standard of care now, the robotic method of
It is becoming the standard of care, robot/laparoscopy. Most patients, certainly, patients who are aware, usually will ask and inquire about minimally invasive procedure, whether it be laparoscopic or robotic.
So can you talk about the difference between robotic and laparoscopic?
They're both minimally invasive. What makes the robot, in my opinion, superior than laparoscopy because of the tool that we use. The robot is a tool that, again, offers us superior imaging, high resolution of the surgical field with the three-dimensional view. It also offers instruments that are very dexterous and can really mimic the movement of the hand. They're joint or wristed instruments that have up to 270 degrees of motion, which really help us get into small spaces and be a lot more precise and accurate in what we're doing in surgery.
Nice, yeah. And is the robot still recommended for recurrent cases if someone continuously has hernias?
Yes, absolutely.
Cool.
We do those all the time as well. If a patient has a hernia that came back and reoccurred, we can certainly offer robotic surgery as an option.
Awesome. Okay, we have just about 90 seconds left. And tell us really quickly, we mentioned your phone number, but mention it again and where we can find you.
Sure. Our office is here at Willis Knighton North, and the number is 318-212-6270.
All right. And are you accepting patients right now?
Yes, we are accepting patients, and if anybody's willing to inquire, just call the office, and our staff will be happy to help you answer any questions you may have.
Okay, probably easiest way is to give them a call. And let's say, for example, somebody called today. When do you typically, or how soon could someone maybe schedule a surgery?
Yeah, we can schedule patients as soon as a week to 2 weeks.
Nice. That's pretty quick turnaround. Yeah. All right. Well, Dr. Brakta, thanks for coming in today and talking about hernia repairs. If you're just joining us and you wanted to maybe rewatch this, or if you missed it, it's going to be on ktbs.com/podcast or /Healthline with the number 3. Thanks for joining us.